Illinois' budget impasse may have an effect on local health departments. Good evening and thanks for joining us. I'm Jesse Guinn.
And I'm Nick Ruffalo. Local health departments depend on state funding to serve the public, but officials from one local health facility say the lack of state funding may soon put their patients' health on the line.
That's right, Nick. But in Edgar County, the health department serves the public through a special program found nowhere else in the area. They say help for thousands of people could be at risk if the budget impasse continues.
The public health system is in critical danger at this point. We are losing, not my department specifically, but the health departments in other areas that have had to make cuts. We're losing critical staff who are trained to do the jobs they've been doing.
Janet Mason is the administrator for the Edgar County Health Department, a facility that serves thousands in the area. But her facility has something rare, which is why she and others are concerned for its future. The Edgar County Dental Clinic is a service of the health department where patients who don't have dental insurance rely on state funding for dental treatments at discounted rates. Isaiah Jernberg is the facility's dental director. He says the issues are a real risk for patients since many of them may be forced to let dental work go, which could make it even worse.
There would be more emergency room visits probably, and right there they can't really necessarily treat a dental infection in an emergency room. A lot of times either teeth need to be removed or needs to have a root canal.
The department runs on government funding, and since July they've only been getting federal grants. Mason says the department gets roughly $200,000 a year from the state, but that's not been the case for the past 8 months. She says even though they agreed to the state's terms for health departments, they can't continue operating on such a limited budget if the impasse continues.
We have met every requirement. Every program is still running from July 1 and to this day, and we have not received a single state dollar. That's not sustainable.
Mason says something in Springfield needs to change now.
Departments, we are the front line. We are the ones that see these people every day. We are the ones that are helping them on a one-to-one, one-on-one basis. And if you lose the front line, where are you going to go?
Mason says patients in need come to their facility from 100 miles away. Mason says all of the health department services depend on state funding. Of course, WEIU will continue following the state budget impasse and its effects.